Hi, Dr. Jeff with NeuroFit, and in this video I'm going to demonstrate our bucket or water treatment used in the Phoenix Waveform. The water treatment or bucket treatment, it's great for anybody who's got lower leg problems, neuropathy, Achilles problems, plantar fasciitis. And what the water does is basically act as like the electrode. So the water is going to be able to cover the entire foot, the entire Achilles. If you got some neuropathy, you would want a big bucket so it goes up higher in the leg. And we're using the Phoenix Waveform. Do not use this. This is for information only. Do not do this without supervision from a healthcare provider, and only use the Phoenix Waveform. We got our Phoenix Waveform Pro Edition here. We don't have it plugged in. What we're going to do is we're using a splicer. So one lead splices into two. And I'm going to put one sticky pad on the leg. Now you don't need to use two of these. You can only use one. If you want to use one, you can put it on the front of the leg, or if they're having an Achilles problem, you can put it on the back of the calf. But for neuropathy, it's good to use a splicer and get two pads. And then we have our positive lead with our carbon electrode and our sponge. And we're just going to put that in the water. And we're going to step on it. You're going to get a lot better contact and a lot better muscle stimulation if you actually have contact with the electrode and the lead. So I got it. If I have maybe Achilles or heel problem, I'll step on it with my heel. If it's a general plantar fasciitis, the ball of the foot. And we turn it to, we're going to use our Phoenix Waveform Hunt. And we're just going to turn that out till we feel a nice tingle. Again, don't try this with any other type of stimulation devices. And there we go. So now what I'm doing is I'm feeling this down through my entire leg, where if I would just have the electrode pads, I would mainly feel it most where the pads are. The current has a tendency to seek out the areas of pain or inflammation, so you may have a more sensation away from the pad right now. Like I have, even though it's on the ball of my foot, I'm feeling it most in the Achilles tendon right here, probably because I did some long hikes over the weekend and my Achilles is a little bit inflamed. So that's what we're going to do, and we're going to sit here and you can do kind of some toe presses, wiggle the toes around. One thing to note, at NeuroFit, we're all about enhancing healing as fast as possible. So if there's other hacks that we could use at the same time to promote further healing even faster, we're going to use that. And that's what I have on my leg right here. So we add restriction blood flow to the training. So you got your restriction blood flow bands, and we have it wrapped around the leg and we tighten it up. What this is doing is actually creating a hypoxic environment to the muscle. Okay? So causing the hypoxic muscle to the muscle causes a few things. Locally to the muscle, it enhances circulation, blood artery formation, and muscle growth. But metabolically, systemically, what it does is it releases growth factor. So any place that's injured, any muscle that's being worked, could be enhanced or helped by the growth factor. So instead of just having the person sit here with their foot in here, we're going to put restriction blood flow bands around both legs and both arms. And we're going to have them do probably some curls. We don't have to do a lot. If we got the muscle stimulation in here, the current is actually doing the work on the muscle, so my muscles are contracting right now. But if we can work the upper body and enhance that full body growth hormone stimulation, it will have a systemic effect. So any muscles that are being worked or are injured would benefit by the systemic growth hormone. So we would put the bands on, we got the pads on there. I would sit there and have them do this maybe about 8 minutes. Then we turn the unit off, and then what I'm going to do is simply unplug my lead and switch it. So now I got the positive lead going to my calf, and the negative, even though this is still red, that's the negative. Put that at the bottom of my foot again. And again, we do this for about another 8 to 10 minutes. You don't need a bucket this big. You can use a smaller bucket if it's just bottom of the foot. But again, if you're dealing with any type of neuropathy, any bigger lower leg pain, you want that water as high as you can get it to cover the area to act like a sponge. Hope that helps. Any questions, drop me a line.